So this final panel, I suppose, is to pull a few threads together, as I say, to just finish with a focus on strengthening patient involvement and touching on some of the things we talked about earlier, particularly digital health, health literacy, and of course the Charter. We'll be using Slido for some Q&A again at the end of this. So I just want to quickly introduce our panel. John Fitzsimons, who you already met, Georgina Cruz, the National Manager of the Patient Advocacy Service, who has a background in community and advocacy and social justice, so I'd say you have a lot to say about the Charter. Maybe Georgina, very important. Bernie, who you've met already, and I have to say, Bernie, I didn't want to single it out, but that photo of you and your new grandchild is absolutely gorgeous, so congratulations on that. Deirdre Hyland, HICWA Health Information Manager, but used to work with us in the NPSO, so hi Deirdre. And Joe Ryan, National Director of Public Involvement, Culture and Risk Management in the HSE. So Deirdre, I might start with you because, as we've talked about today, digital health being the next big transformation agenda. And I think, as Demi and others said this morning, really important to engage patients and public and involve them in co-design, and that HICWA recently published a national engagement on digital health and social care. So I'd really be interested to find out, what is the Irish public thinking right now about the digital health agenda?
Right. Thanks, Kate. So I suppose HICWA, in partnership with the HSE and the Department of Health, conducted this national engagement on digital health and social care, and we also had two patient representatives kind of on our steering group. Tiberius was one of them, so thanks for his contribution. I suppose, we were mindful that WHO does emphasise the importance of engagement when digital solutions are being put into healthcare system, and in the context of EU targets around people having access to their online health records by 2030, and legal kind of requirements coming from the European Health Data Space Regulation and also the Health Information Bill. And we were keen to go out and ask both the public and also professionals working in health and social care services their views and opinions about their readiness for kind of a more digital element in health and social care, including having access to online health records, and also the benefits that they perceived and the challenges. And I think some really interesting findings. We published the findings on 4th of September, and we also published a response from each of the partner organisations how they intend to use those findings. And I suppose the standout message was both the public and professionals are ready to engage or embrace a more digital aspect to care. People are really keen to have access to their online health records. 74% of the people we surveyed over 2,000 members of the public, and we also conducted focus groups kind of with people including minority groups. And 74% of them told us that if an online health record, or when an online health record is available, that they will access it. They think it'll empower them as partners in their own care. During our focus groups, people talked about having autonomy, being involved in decision making. They also told us that one of the big things that both the public and professionals said they'd be able to do was to be able to let people know if there was missing or incorrect information in their online health record, and the benefit of being able to tell your information once and it's shared across all the different care settings and with all those kind of professionals that you're seeing. They saw that would have a really big and positive impact in terms of patient safety. People also said that they were really positive about being able to manage their health kind of in between their healthcare visits and using that information. We heard a lot about the trusted source of information, understanding your diagnosis, and people said if they have their information in an online health record, it would really help them to prepare questions before they go in to meet with their health and social care professionals. So people are really ready to do this. They think it'll have a huge positive benefit, and in particular in relation to improving patient safety, and that they'll be empowered to be part of that. So
yeah, and I suppose as all of us, we use digital to run so many other aspects of our life. So in one way, sometimes I imagine that we'll really take off at a velocity because we, the people, are so ready for it. Might turn to you, Joe, just in terms of the national role and how these agendas then filter through in building, I suppose, the patient engagement model, particularly in the regions, but but being modern about it and taking it, I think as we said, where people are actually at, and what are the kind of key things that you see from both the digital agenda but also then the literacy. So there's that weird combination of people being very educated and being very literate and digitally savvy, but also the vulnerability and literacy difficulties that comes with, a stressful point in your life. So capturing all of those various experiences and how to feed that in. Maybe talk a little bit about what that means for your role, and particularly now as moving into the regions.
Yeah, thanks, Kate. Yeah, the role sounds a bit odd to people when they hear it first in terms of, it sounds like a very broad thing, but in fact they're all very interconnected. So the public involvement and culture, I think, are joined at the hip. Every comment I've heard this morning, every speaker has referred to culture underpinning everything. And risk, and governance, falls in behind that. And in fact, part of that role is also data protection. And it's, I think we need to work with our patients as we have, and we need to do more of that in the development of these tools that help us. Whether that's some of the digital innovation tools we're doing with the app, or indeed the electronic health record or e-prescribing. I know Bernie's been involved in that one. That having them there means that we will design the tools better. Okay, just as we design our care pathways better when we have our patients involved in it, and the outcomes are inevitably better. I think it's important, though, that as we develop, whether it's a piece of paper, a leaflet with the 3 questions on that help us to guide, or to guide ourselves as patients with our clinicians through that journey and that diagnosis, it's important that as a service, the 140,000 plus people, and it's probably a lot more than that, that we're all aware of the fact that these tools and these processes and these initiatives exist, and we embrace them. There's nothing worse than a patient who comes all prepared and has steeled themselves up for that journey, and then perhaps meets a little bit of a block where the person says, "Oh, I don't really know about that," So culturally, we have to make that shift where we embrace that involvement. And I think I struggle a little bit with when we talk about patient empowerment, like we're giving the power to the patient. The patient is assuming their own power. So I think as we, and if we all understand that core cultural underpin, then I think, the potential for all of the health literacy tools and the digital tools that will enhance that exponentially, I think they realize their benefit then. But unless we do that, unless we make that cultural shift where we embrace the patient's right, and the Charter talks about the right, to determine to partner in their own care, then we won't realize the benefit of it. And I think we've heard, from all of the eminent speakers today of where that, how powerful that is. And, it's a missed opportunity if we don't give it every chance to succeed.
And I think it probably sounds like a theme for a future conference. Moving to you, Georgina, then I suppose these reforms, then coming from where a service like PAS comes from and meeting people at maybe another difficult juncture in their interaction with the health services or their patient journey, where do you see, I suppose, that these reforms can maybe strengthen patient advocacy, link in with what Joe was saying, perspectives from I suppose the work you do and the people you help in PAS?
Yeah, I suppose there's 2 sides. On the digital side, you definitely see the benefit in those electronic health records and, the opportunity for, on I suppose the theme of today, those timely diagnoses. What we see is people who have had misdiagnoses, late test results, all of that can impact their patient experience. So I think on the digital side, those health records are important, but also following on from what Colin was saying today, is that digital change so you can measure everything that's going on. You can measure your patient safety, you can measure your quality. Without that data there, you can't really move forward with that. I suppose from the regional structures point of view, I think that'll be a big challenge in 2 ways. It's going to happen, it's a massive change that's going to happen quite quickly, even though it's going to take a few years to bed it down. So there's that whole change where it's at the moment, where even from a staff point of view, the integrated care idea is going to be a challenge, especially in I suppose, across services, health and social care, where you have different providers, you've the HSC, you have volunteers, you have partnerships, you have private providers, so that timely and effective and appropriate care, I think, will be a challenge for people. And I suppose as an advocacy service, I'm reaching out around the patient and service users engagement. It's seeing who the people are, who we can feed our rich pool of data that we collect from the service users that we support, to make sure that that's going into the system, that the structures of the system follow down from the national down to the regional, and that learning follows back up that line. We support people with complaints and patient safety incidents. We're swinging over two different sides. Complaints are now sitting in under communication, patient safety is in under the QPS, and it's making sure we have that triangulation of that data, to inform improvements, inform patient safety, all of that. So there's a lot of challenges, I think, coming up, and I think, we've the new Patient Safety Act coming out, so that'll raise other things as well, and I know safety culture has been talked about a lot this morning, but I think it plays a huge role, and managing that. There is an opportunity there with the new regions to be able to bed that down at a very early stage and grow it, rather than unlearn it,
Yes.
in a bigger organisation. But, I think that safety culture and that communication is key. Like with the people we support, 60% of the issues are around communication, and that's either how it's said, how people are listened to, the respect, the response, the right to be heard, and the response following that, so yeah.
Yeah, and as you said, I suppose there's an opportunity to, as I said this morning, build on a lot of the good that we already have about trying to achieve that consistency. So there's the need for lots of data to tell us, but there's also a need for simplicity. And I suppose having that singular, consistent vision, so whether it's through a national standard or a vision that we're all trying to achieve, that everyone, I suppose the hymn page we're all singing off. And I suppose when you look at the charter, it kind of struck me, working on the side of either policy or a provider, the things that are expressed as patients' rights are then the goals and outcomes that we're trying to achieve. So we're coming at it from a different side. I might just ask for maybe reflections on the Charter. John, if you don't mind, to go to you, because obviously you've spoken through the podcast and the earlier bit about some of the other elements. How do you see in your work and from your experience, I suppose, continuing to strengthen how we express and strengthen patient involvement? What do you see that bringing to improving patient safety?
Yeah, I think certainly welcome the Charter, and I think there's nothing there that I think is not going to move things on. I think, looking through it, there's going to be some things there that will be challenging, and I think we will have to have good conversations and good communication with people. I'm struck again, when the Institute of Medicine defined kind of the features of quality healthcare, the initial phrase they used was that one of the 6 domains of quality healthcare is that it should be patient-centered. And I think, there's a greater recognition that within a few years that word wasn't sufficient. I think we've moved to this idea of being person-centered. So that we recognize that the personness of patients, and your illness happens within the context of you as a person. But that idea also opened up, I think, space for all of the persons in healthcare, the people who do some of the caring, families, carers, guardians, and healthcare professionals. And I think as I look through the rights as well, I'm also seeing, what are the person safety rights, that are going to need to be highlighted. Because I think Bernard and Robert, we're talking about dancing this morning, and a lot of this is, it creates tension, but it can be a good tension if it turns into a dance rather than any sort of a conflict. And I think that's what we need to do, I think, is turn this, there are very challenging things in here for us to do. And I think Bernie very eloquently outlined the reasons for doing them. So I think we all know why we should do them, but they're going to be difficult. And I think, we need to be able to to talk about that.
And I suppose we're always, and as it is in every field, maybe changing our vocabulary every few years to try to keep up maybe with the times and where people are at, or I suppose stretching to try and better explain what it is that we are all about. Bernie, I know you've already spoken about the Charter. Is there anything that you want to say just in relation to, I suppose, the piece, which I know is really important, Patients for Patient Safety Ireland, about the literacy and digital literacy, particularly of some, but not all, older patients, other patients? How do we ensure that we don't leave people behind as we move in? Are there things that you think would be important to consider, or maybe to partner with or think about as we move into the digital agenda, so that everybody can benefit from that?
Well, I'm sort of envious that my grandson's starting out in life, because I think his experience of healthcare is going to be a lot different than mine, just as mine is different than my mother's. My mother's still alive, thank God, and in quite good shape for a 97-year-old woman. So, you know, my little grandson is going to experience healthcare in a different way, so he's going to be part of this. He's going to benefit from this digital age that's coming at him, and he'll be well ready for it, whereas my age group are still just about able to manage computers to the level that just about manages what they need to do. Like, we're just not totally at ease with them. I suppose we're the transition age group, you know, between the people who are coming up behind us who are good at IT and the people ahead of us who mightn't be as good. A lot of our older generations do become very proficient, and I love to see where there's like, say, in transition year, where they might match up transition year students on an experience working with older people to kind of share their younger skills with our older people who have that experience, because I mean there's nothing beats life experience, you know, so there's a yin and a yang, you know, there's an exchange. Yeah. There's a knowledge exchange between generations. So, yeah, I think what I would hope was, I think our education system needs to embrace healthcare in a bigger way, and I think health literacy is as important as any of the subjects we're currently taught in school. Or, you know, I think that it's untrapped part of our education system, that I have this theory that, you know, from the time your mother and father launch you into the school, into education at 5, right, that's when you start undoing yourself. Like, you start undoing your own health from when you become aware of that you have an independent yes. Like, I have a 3-year-old grandson, right, as well, and he's getting to be a right independent little fella, and like, he hasn't even hit school yet, he's just started kindergarten. But like, I'd like to think that we become aware of how to care for ourselves through health literacy long before we become ill. Yes. That you can actually make life choices that dictate, like I'm thinking around mental health, you know, substance abuse, all the stresses that come on us through our lifestyle choices that develop when we're young. You know, like, most of us have developed our bad habits by the time we get to 20. So that's our education time, like from 5 to 18 and into college, you know, in our early 20s. So that is a real time to get people and to culture their literacy skills. And I think if you build health literacy into that period, you are then turning out a generation of people who are health aware and who will use services in a much more sustainable way, because we can't keep using services to the level we're using them at the moment. Our services won't sustain them. Healthcare has become a kind of nearly a product of its own success, and the stresses that have come on it are because it's become so good. My mother's generation didn't depend on formal healthcare. You know, they were into cures, faith cures, you know, having hot milk with whiskey in it or whatever it was that was there. Yes. You know, they're maybe a placebo in some ways, but they didn't have that access to healthcare. Even like, I come from the midwife generation, you know. I was saying to someone earlier on that I thought the 5 siblings that followed me into our household came in the midwife's bag. I didn't blame my mother and father at all. I thought they had nothing to do with it. So, like, the development of healthcare from the late 50s to where it is now has been massive.
And as I think, you said, for your grandson, it'll
be, so I know he's going to absolutely have, you know, so much more.
The ambition is that maybe through
keep him healthy, let him live a healthy life, because he's able to control his own health awareness.
And there'll be empowered patients holding their power
Yeah,
from
absolutely.
the
No,
start.
you know, nothing is going to hold off health challenges. Like, with
No.
the best will in the world, we're going to meet them. But, like, the longer you can push them out there, you know, if you push them to your old age rather than be meeting them in your younger life, well, then you're taking a lot of pressure off the health system.
Yes, and enjoying your life. I might go back to you, Deirdre, and then to Georgina. I suppose, looking at the charter, how you think, I suppose, the charter meshes with the things you've spoken about, maybe that right to information, which is key to unlocking the power that people have in their care. So, Deirdre, maybe to you first.
Yeah, absolutely. I think that there's the two kind of elements of the Patient Safety Charter, kind of around the access to the medical records, and then also the right to information, education and supported decision making. And they definitely line up really kind of well with, I suppose, what we found through our kind of engagement. We heard a lot from the focus group participants around kind of people like older people or people in kind of those minority groups wanting to be able to access their information, but they do need supports, they will need education. Health literacy, digital health literacy came up a lot. People talked about their 90-year-old granddad on YouTube, but maybe not being able to understand kind of, you know, information about a medical condition online. I suppose, and it came up quite a lot across the kind of programme today. Information is only as good as the quality of the data that goes into it, and I suppose that's foundational in terms of us putting in digital solutions into the healthcare or providing any information to the patient. It has to be good quality. You know, and that's certainly something that we are very focused on in HICWA around our programme of developing national standards for health information, standardising information so the same information with the same meaning is captured across all the different care settings. And then we've also kind of published standards for the management of information as well earlier this year, which really kind of like a key principle of that is around promoting people's rights to accessing their information, but also people's rights to how their information is collected, used and stored, and you know, that data security and privacy kind of piece. So I suppose there's a lot of good work that's being progressed at the moment, and in HICWA, everything that we do, we kind of have public representatives involved in all of those projects. So that's a key way that they can get involved in terms of making sure the quality of the data is, you know, appropriate and is the right information for people when they need it.
Yes, and Georgina, I suppose from PAS and from a patient advocacy perspective, then how do you see maybe your role in promoting or working with the rights within the Charter?
Yeah, I suppose our service itself is there to uphold the rights that are there. I think these rights are already enshrined in a lot of the legislation and the standards that are there, and the policies and the procedures and the frameworks. Yeah, if we're talking across the health and social care, there are gaps that I think need to be developed in and around safeguarding the deprivation of liberty, you know, the mental health, you know, maybe the clinical judgment piece and licensing, you know, so there's definitely gaps there. But I think for us as a service, what we're trying to do is, I suppose, promote that consistent implementation of the rights across the system, because it doesn't happen. It's different in every area you go in, and now with the integrated healthcare, I think that'll be more pronounced. So, you know, that's one of the keys, and the way we do that is by supporting people who come to us, those patients and residents in nursing homes. It's, you know, informing them of what their rights are so they understand, so they can push the process to become that person-centred, human rights-based service provision, rather than, as somebody said earlier, that patriarchal style, you know. But I suppose empowering the person to have, as I said, we support people through patient safety incidents and complaints, so that right to be heard and resolution is a big thing, you know, so that access as well to the records. Some people don't find out things until they actually access their records, you know, so the digital would certainly help there. But also the way they're treated through the current processes. There's very good processes there. There's the Instant Management Framework, open disclosure, the Your Service, Your Say, you know, even clinical meetings. You know, a lot of the clinicians are willing to meet people, explain it, but it is how that person is treated through that process that undermines their human rights. And I suppose from us, it's supporting them to uphold their own human rights, you know, and it's bringing that collective voice as well to the table. Part of it, the advocacy, is highlighting those systemic issues and those policy gaps and being able to bring that information to the table so we see those improvements. And, you know, following up from Bernie, like the health literacy side, I suppose as our service supporting people through what we do, it's preparing them for what's coming up so they understand what their rights are, what the processes are, what they can expect, you know, because there is a lot of trauma that we see the other side. There's a lot of good that happens, but we see the other side and we're still seeing it, and there's still patient safety stuff happening every single day. So, you know, embedding these, and I think, as I say, they are well enshrined and they really follow everything, like that safe healthcare, timely, effective and appropriate care is going to be really important in the integrated care.
And it gives us a shared, I suppose, perspective. And maybe to you, Joe, in your role, maybe to reflect, and I know you have your own big conference next week, if you want to give a plug for that as well, but, you know, there's probably a big overlap in terms of where you come with patient and public involvement and the concepts behind the Rights Charter.
Yeah, I mean, when I looked at the Rights Charter, it's kind of split 50-50, and the ones that are, you know, the kind of the first 5 that are on there are almost, I suppose, implicit on, you know, relying on co-design and putting things in place, and then the others really, the kind of 6-10 really get at the human rights, you know, and I think it's important that we take things like the Charter and make that accessible for our patients and service users, so that they've got something that they can refer to that doesn't feel, you know, kind of onerous, if you like. So, and you know, it shouldn't be something that they only find out about accidentally. We've got to find a way of getting that message out to as many people as we can as to, you know, what the Charter is saying, and more to the point, what we as a service together with our patients are actually doing about these things and meeting those. And the department as well has a huge role in terms of setting the policy framework for us to do that within. So I think that's probably the one of the big challenges we have. The digital enablement part of that, you know, is I think we're in a stage now where, you know, people say, oh, you know, people are, you know, wouldn't be as digitally literate as you know, say younger generations. I worked in the digital hub in Thomas Street 20 years ago, and we were having that conversation 20 years ago. So I think there's plenty of digital literacy amongst our, and I'm counting myself now in that older generation. According to Fingal County Council, I am in that older generation. So we need to maybe just not step forward into that space of you know, making more things available digitally, you know, and including how patients actually get involved in this, you know. I think it was said earlier on that it was Bernie yourself said, there's a small number of people tend to be involved in things like Patients for Patient Safety and the forum, whereas, you know, there's 5.5 million plus people out there, all who will experience our health services more frequently. So getting their voices in as early as we can is really important.
Yeah, and just on the slide, a really important point about the digital literacy of the workforce. And I suppose even just being digitally literate, how do you know whether you are or not? And I think for many of us, there's probably going to be a reassurance piece that you're more digitally literate than you realise. But I think it's supporting the workforce, you know, particularly when they hear us, you know, speaking about those words, or they're in a strategy document, like what does that mean on the ground? And a lot of that is to make your job easier, free up your time. And if you already do online banking or whatever, that, you know, some of this isn't going to be more onerous. But I think Demi this morning made that really important point that if they're not designed with the people in mind, then they're just going to fall flat on their face. People aren't going to use them. They'll use workarounds or whatever instead. So think that's an important point. Some of the other comments coming on Slido just were in the timeline for EHR. So I think we're piloting the patient app and we're piloting the EHR in places or whatever. So I think 2025 you'll certainly hear more about it and more of it becoming available to people. And I think one of the top questions again is about that consistency. And I know it's been a theme of, all of the benefits of moving to the regions. The risk, so to speak, is that consistency. So I loved when Sarah and Andy spoke this morning about leading by example, and they meet every Friday morning. I suppose maybe just a quick word from anyone on ways to achieve consistency. Maybe we'll start and go across. Joe, just how do we harness all that is best about these moves and minimise the risks or the concerns we have about this isn't going to work as well as we thought it might,
Yeah, and I think the consistency question, a huge amount of time and effort has been invested and has included our patient partners in the design of the regions and the new, and Bernard will be very focused on this, slimmer centre. And having a consistency there while allowing regions to actually adapt to the local need. But I think, so what there is in the centre is that, if you like, we create the frameworks and then the regions will implement how we do that. We'll have patients connected to that. We'll have local patient councils, we'll have the National Patient Council, and we'll have the forum. And all of that will work together. And I think we'll work with the regional executives and the IHA chiefs when they come in. So it's really important that that whole system works together. But there will be a need for a little bit of local adaptation. Act locally requires sometimes that it doesn't work exactly the same in Cork, Kerry as it does in
Anywhere
Dublin
else,
North East or in Donegal. Do you know what I mean?
Yeah.
So and I think, really the most valuable thing is that there's that close working relationship amongst that senior leadership team and their teams. If everybody operates to those values and keeps it going, I don't think we'll go too far, of course.
Very good. Deirdre, any final reflections?
I think probably again back to, I suppose, the HICWA hat on really, and kind of how we develop those standards from a national level, and it's really about that kind of involvement of kind of the public patient representatives, but also kind of the new people who are standing up kind of those regions, and that we have that kind of collective co-design approach, but they're national standards, so we very much set out what's expected in terms of data quality and what type of information needs to be captured regardless of what region you're in or what service you're kind of accessing. So I think that would be the key kind of from our point of view. It's that involvement and engagement as we go through that standards development process and implementation and guidance and supporting people to implement them. We'll be doing a lot of engagement. So hopefully you'll see a lot more of us out in the system in the next kind of 12 months.
Great. Look forward to that. Bernie, any final reflections from you?
Yeah, I think you just have to embrace change and move with the times. My mum has a theory that if they didn't let Pula Fuka be flooded to allow for electricity, they'd still all be reading by candlelight. So I think you have to move, you have to trust change and be excited by change, like engage with it, and we're growing a new way. So just work with it, not against it.
A positive attitude
don't be looking
towards
back.
it. Yes. Okay. And future focused. Very good. Georgine, any final reflections from you?
Yeah, I think the consistency, just following on from Joe said, there's obviously the consistency within the structures, but I think your patient and your service users, the learning, I think sharing that learning across, and the fact that it's going to be population based, there will be different dynamics, but it is, I think it's sharing it across, back and forth and up and down, and it's, the lived experience from people will inform a lot of that, because they're going to be trying out the system. So, and the data that's gathered there as well, to use that. So your consistent things are going to be your data and your patients, and it's bringing their voice to the table and that learning.
And having, I suppose, particularly in the early days, more of those opportunities and mechanisms to hear from the system what's working and what isn't, so we can jump in and tweak things or that we're not
and
just...
As Bernie said, it's not about, don't be afraid to change it, If you're putting something in, this is trial and error process, really.
Yeah.
And it's hopefully that, you know, by the time we're going into the system, Bernie, you and me, we'll be in the system together, that it is perfect, and we won't have to worry about it.
That's my feedback in action there. So.
And you have 6 opportunities, haven't you? You have six regions to pick the best of everything.
That's it.
You know.
Yeah, and I know we're good at putting on the county jersey for some things, and you know, embracing
no neighbours rivalry now.
Competitions between them. And John, any final reflections for you before we wrap up?
Yeah, well, just to build on those, you know, one of the principles of quality and quality improvement is seeing and understanding variation, and like it's just been said, there's now 6 regions who will all be doing things, who will maybe pick slightly different priorities, but we have this opportunity to learn from what they do best in each region, and for each region to become a positive deviant in its own area. And I think it's great to hear that the group is kind of set up as a learning system, you know, to share that learning. So, yeah, I mean, I think this is 6 opportunities where there might have been 1 in the past to learn. So, yeah.
That's a very good way of looking at it. So, on that positive note, I'd like to thank John, Georgina, Bernie, Deirdre and Joe for the discussion panel. So, thank you very much.